welcome to the Environmental Justice Lab. I am your host, Dr. Leslie Joseph. Thank you so much for being with us. And we still have our very special guest, Savannah Damage, with us. Savannah, how are you doing?
I'm doing good. How are you doing this fine, brisk day?
I'm doing very well, and this is very brisk. So even in South Carolina, it's snowing. So it's just
Oh,
weird. It's weird how cold it is everywhere I go. And so anyway, we have been speaking with Savannah over the last couple of months about legacy environmental injustice. She is from Rochester. She knows all about what's going on there, and in particular, the Kodak facility and how that's impacted life in Rochester. I think last episode we talked about some of the health implications, some of the health issues, and the pollution specifically that comes or that came from Kodak and its facilities. But on this episode, we want to get more into the actual care for the people, healthcare specifically. What do people do once they are sick from this pollution and from all the issues that Kodak brings to this community? And so we're going to spend some time on this episode talking about that with Savannah. She knows, and she's going to help us to understand more clearly what happens once somebody gets sick in Rochester. So, Savannah, kick us off. Tell us some of the things we need to know about the healthcare system in general and what happens in Rochester specifically.
definitely. So I think to start off with healthcare, like in general, I first must put a caveat that I am not a healthcare expert by any sense. So I'm gonna try to keep things not like super specific, but do more like general as well. Cause I know we got listeners all across the world who may or may not be super familiar with the U.S. healthcare system. So in the U.S. healthcare system, we don't have like one national system. It's a bunch of like different separate insurances, if you will. So there's mixture of public and mixture of private. Most of the people in the U.S. who are insured tends to be through like a private plan. So that could be like through somebody's employer, or they might just purchase it on their own. So tons of different names. You have your Excellus Blue Cross's Blue Shield, you have your Cigna, you have your Allegiant, you have your MVP, you have your Aetna. I could just keep on going and going and going because there's so many of them. And then for the more public health cares, we're looking at the Medicaid and then the Medicare. Very similar names, but they do two different things. So typically, Medicare is for those who are older, they may be retired, and that's kind of that you pay into over the course of your life. And then the Medicaid is more for like low-income families, low-income people who maybe cannot get an employer-sponsored plan or cannot afford it. And there's also like a few other people, like if you were like in the military, you can get like a Veterans Affairs plan sometimes. It depends on how long your service was, what you're making. But even still, even with all these different plans, about 8 to 10% of the US, depending on what survey you look at from what year, is uninsured. So yes, you can still go to facilities to get medical care, but you're going to be paying a ton of money out of pocket because usually the insurance is helping you to afford things. And even still, insurance can be very, very stingy sometimes. Like for example, say you want to get like an elective surgery, they have to determine that medically not necessary kind of thing. It takes time. So my roommate last year actually was from a different country, and she was like, "Oh, I can just go to the dermatologist like in 3 days," and I'm like, "No, you can't. I mean, you might need a 3 month wait for that. Not to mention you got to make sure that they take whatever health insurance they're giving the students here." And she was like, "What? That's not how it works where I'm from." And it was like a whole thing. And hopefully, she eventually got to the dermatologist. But like the dermatologist is also, a specialty service. So sometimes your insurance would be like, "Well, first you need to go to your general practitioner." Typically that person that you see like for your once a year checkups would be like, "Oh, you're doing great," kind of thing. To even like get like a referral that you might need to see somebody. So you have to like go through all these steps and hoops to kind of like get the care that you need. And then also there's like steps and hoops with the insurance as well. And then sometimes even still you get this ginormous bill at the end. It's not uncommon to hear of people in the US having tens of thousands of dollars of medical debt because the insurance will not cover certain policies, certain procedures. There's things like co-payments, cost sharing, deductible plans, which is all, to be honest, beyond me to be explaining exactly how that works. And plus, also each plan works a little bit differently. But this is kind of a brief overview of the U.S. health system. And then going more into like how it works in Rochester, from my experience, it's more like if you do not have insurance and like typically you want to avoid the doctor at all costs, unless like something's like you're dying because like it's just a lot of cost. You understand that it's going to be very expensive, which can be very unfortunate
Mhm.
because sometimes that you might, be suffering longer than you need to be suffering, or you may not, your body might heal itself over time, but you still have like lingering complications because you really should have got maybe a prescription for that or something. And so if you're doing really poorly, typically you go to the emergency room first, from what I've observed, or maybe perhaps even the urgent care. If you happen to have insurance, it depends on the insurance. It's all dependent on, where the insurance wants to go. I can tell like you numerous times I've been on the little portal finder, and you're like, I'm looking for this. Okay, here are my options. Let me just start calling them. Are they even taking new patients? Because sometimes they aren't taking new patients. So I will say one of the struggles in Rochester, New York, is that we have a shortage of general practitioners. I think there's probably a more proper term for that, but basically the people who are like kind of like, or like for kids, and we do call it your pediatricians. There's just a shortage of them. So, for example, like I
Mhm.
myself do not have an adult doctor. I still have like my childhood doctor because I can't find anybody. There's like, all like when if new patients, there's just too many people, not enough people going around. So that can make it really, really hard to get those referrals if you need that. And then also sometimes general practitioners can notice things like year to year, like, oh, your mo has really grown since the last time I saw you last year. Well, maybe you like being
Mhm.
like, oh, I see it every single day. It looks the same to me because like over time you can't call to notice like really small changes. And maybe that's the case where like they find out that your mole is cancer or something. And if you hadn't gone to your general practitioner, you would have never have known until it was like really really bad. Um, it's just also, at least in Rochester, also we have a giant, I would say, perhaps oversaturation of medical services. So there's tons of buildings everywhere. I think a previous podcast I mentioned, like an urgent care is like popping up everywhere, just because like one of our major employers is the healthcare industry. But just because they're everywhere doesn't mean you can, get in there necessarily, or that it is affordable to get in there. I think that's a big concern. I know in past times we talked about there's a lot of families in Rochester unfortunately living in poverty. Cost
Mhm.
is a big thing. If unless it's like I'm seriously concerned for my life kind of thing, something's very very wrong, you're not going to want to go because it's just that it's going to perhaps break your budget for that month or put you into further debt or into new debt. So I guess that's kind of my take on the Rochester health system. I'm sure someone who does billing for it or like actually like works on like the medical field and sees patients as like their every single day thing would have probably some more elaboration that they could give. But I don't want to like be giving out wrong information either about how things work.
Yeah, no, that's fine. That's great information. I guess just for clarification, because a lot of us wouldn't know the differences. You talked about going to the emergency room. You talked about going to your general practitioner, who you're saying there's fewer and fewer of, so they're harder to find. And then you made the comment about urgent cares popping up everywhere. And so, could you talk more about the differences between all those three? Because if I'm a poor person and I'm sick and I'm concerned about cost and I don't know what to do or where to go, I don't have a general practitioner that I kind of always see. Would I go to the emergency room? Would I go to the urgent care that's popping up everywhere? Do I have um what do I think about what would be the best option for me? Because I guess there's pros and cons to both. So what would I actually do if I'm a Rochester native in that situation?
I would say I would say you'd probably go to the urgent care first. So we
Mhm.
have three different emergency rooms. So there's Rochester General Hospital, Strong Memorial Hospital, and then Highland Hospital. And typically, like from what I was saying, like Rochester, like the Rochester General one, you only go to that emergency room, like if you're pregnant or you're shot. So in that case, like that's just, it has like a bad reputation, that emergency room particularly. The other ones have a
Wow.
bit of a nice calmer reputations.
Hmm.
Um, so in that case, it also depends, is like also like what you're experiencing. So like for example, like when I broke my wrist, my family first took me to like the urgent care, being like, well, we know it's going to be cheaper. The problem is they don't reset broken bones in the urgent care. You have to then, go to the emergency room to get that done. So sometimes they transition you over depending on like what kind of service you need. But in my general thing, it's more like the urgent care, because people understand that the emergency room, unless you're like having a heart attack on the floor, you might be sitting there for 6 hours, and that's a waste of your time if you wait patiently to be seen. And
Hmm.
in urgent care, it might be okay. You might be waiting for an hour. That's a bit better, especially if like you don't know how bad your condition is. There's also like sometimes urgent cares, you might have one like nearby in your neighborhood. An emergency room, you might need to like get on the bus for that. You don't want to call an ambulance because that's really going to be expensive, or you have to like wait for your friend as well. So it's also a matter of like how close something is as well, I would say.
Oh, that's interesting. Yeah, that makes sense. And so I guess the idea of having these urgent cares pop up is that they become more accessible to the community. From my experience, they're not that much cheaper than other approaches. Definitely not cheaper than your primary care physician or your general practitioner. That kind of person is definitely the cheapest option. And if you're listening and you're in America, you need to find one. You really do, because the way our system is set up, that's the best way to reduce those costs and to get the care that you need on a consistent basis. And so we're set up that way. You're right. These private insurance companies, they're definitely profit driven. And so one way of profiting is denying claims, denying certain procedures, denying care in different instances. And so they do have a lot of resources spent on determining if something is medically necessary, or if you have the proper referrals or the proper administrative things in place to get the care you're looking for. So there is a lot of red tape, a lot of hoops to jump through in many cases to really get significant care. So it's good to have that overview of the healthcare system. It's good to understand the kind of landscape that's in Rochester. So now let's dive into Kodak and what they've done and how that's affected the health in the community. And so I know a lot of people who, when they can tie their condition to a company, you want, restitution. You want that injuring company to pay you for your hardship, for your suffering, for your medical costs, for your loss in pay from not working, disability, all these different things. Is that something that's been discussed? Is that happening? Has that happened in Rochester? Has Kodak done anything in that regard?
I would say there's a sense that beyond like the traditional, I would say like your traditional like OSHA, your workers' compensation from the past. No, it's really not been done. So part of the issue is, since they went bankrupt, they don't really have funds to be giving these restitutions, if you will, because I mean they're pretty much, they spend it for other things. I mean, if they're cutting pensions as well, they're also going to cut like any chance that you got sick from our chemical. It's like, well, that's too bad. The only exception that I am aware of is for asbestos. And the reason for that is because
Hmm.
the money is not coming from Kodak. It is coming from the asbestos manufacturers themselves, who way back when they went bankrupt, they had all these different trust funds that could pay out to pay people for, mesothelioma or other asbestos related conditions. So in that case, you're not actually, even though you were exposed to asbestos at Kodak, you're not really, in a way, I would say, for lack of a better word, suing Kodak. You are more suing, these asbestos companies which, put its products into Kodak. So it's kind of like a weird workaround. But unfortunately, there's really nothing like, if you can say that, well, you can't, I would argue you can't say with definitive cause that, hey, my kid got, brain cancer from Kodak. You can't prove that, which is one of the hard things about cancer in general.
Hmm.
But unfortunately, even if you're convinced you are, they're going to be like, we're very sorry to hear that, but we have nothing to give you. Because even when they established their trust fund, when they went bankrupt, it was only for environmental things. So to clean up the river, do some, long-term monitoring with the groundwater. So it's, I mean, I'm glad they made the trust fund for that, but not everything, unfortunately, there would be a fund to pay out things for these employees.
Oh, that's interesting. So there was nothing set aside for people who work there, people who live nearby, people who go to school there, people who are exposed. There's nothing available. There was never anything available from Kodak for those individuals, except in this very particular asbestos, I guess, agreement that they made.
It is possible in the past. It was like, what if you got like for them? They knew that like the workers are having higher rates of pancreatic cancer, so there was possible like documentation from like the 80s that they may have been, more gracious with say like your insurance plan. But now that they're bankrupt, there's nothing left over. Anything that there may have
Hmm.
once been is gone. It's been used to other purposes essentially.
Oh man, goodness gracious. So, huh? So we have this system in Rochester of healthcare. We have Kodak, who has polluted and harmed people from their operations in Rochester. There's no money available. So what's the next thing? What can we do now to help or to at least get people to understand these connections and advocate in a better way?
I guess the first thing that like to advocate when you advocate something, you first gotta understand it. So I guess I would suggest anybody who's interested, even like in their own community facing its own issue, is for like education, I would argue. So understanding who's affected, how long ago, what are the lingering effects kind of thing. And then also like what are the effects? Because so just to start you like the advocacy work. And then like I think about like a lot of things possible is like mutual aid where the community is essentially supporting members in its own community when they
Hmm.
can't, get money from other sources, often because those other sources are the ones that are directly doing them harm. So like a good example I think a lot of people are familiar with is like the idea of like GoFundMe kind of thing. Here's me, here's my plight, here's why I need money. Would you please consider donating to me? And I think that's a good example, but it alone is not enough. There's also like the sense of like in personality, and if like you don't have like that like people like in a way campaigning for you, like
Hmm.
you're just going to be one of probably millions of different like causes on GoFundMe, which are the good causes, but people aren't going to know that you need help. Which is why I also think like community organizations would be like great, like different meetings. The issue, unfortunately, with a lot of community organizations is some of them, they existed prior to COVID, and then COVID happened. You stop meeting in person, things stop getting done as much. Like there's less connection as well. So we really also see like some communities as well. They don't know each other as well because these community organizations where maybe you had like your block party maybe once or twice a year. It's not happening anymore because COVID said we can't get together. And then once these things tend to lapse for a year or two, it's just hard to get them back up and running again. And then I guess another I would like think that we could do to support these people is so I mentioned a lot of people in the U.S. are uninsured. Uh,
Hmm.
in general, in Rochester, the uninsurement rates are about 4 to 5%. So it's possible that maybe these people have been denied from insurance. They don't think they qualify, but maybe they actually do qualify. Because
Hmm.
to get Medicaid, you have to go through a bunch of hoops. You gotta like bunch of paperwork, and then you gotta like show up for a meeting to be like, I really do exist kind of thing. And there's also can be very hard to like navigate exactly, okay, what exactly does my plan cover kind of thing? What am I responsible for? So helping people to really understand insurance. I mean,
Hmm.
for me, I'm on my mother's insurance, but I don't understand it all that well. All I know is you go to a provider on the list, you show up, you give them a bunch of cards, you give them a card, you give them your credit card at the end, and you hope all is good. But like helping, I guess making insurance more understandable to
Mm-hmm.
people. So kind of like being like, I guess, an interpreter, because so much of it's just like, I feel like, legalese. And also, I would also challenge like people out there who are writing these plans. Please make it like accessible to like your common person who does not like do everything in the healthcare industry.
Mm-hmm.
I understand that you probably can't change the actual language of the document for legal reasons, but at least like a little like you know general audience. Not that any audience is truly general, but like in that spirit, like a general audience that anybody can understand what you're trying to get at, what they can do. Because as it is, we have to have community members trying to interpret this, and some of those community members, they're really like well-meaning, but they could be like people like me, where it's just like, I mean well, but I'm going to try my best to interpret this, and if it's wrong, oops, kind of thing. And that
Mm-hmm.
that could be a $1,000 mistake because I interpreted something incorrectly. And then, oh, I could keep on going. I could talk about how like it takes forever to get a hold of somebody in insurance sometimes, or it's like, that's not my department. Let me transfer you, and it's like 10 minutes later. That's also not my department. Let me transfer you, and it's like, and by the end you're like 1 hour later, you're so fed up, you just want to be like, just
Mm-hmm.
be done with it. Um, or of course, like the robo, where it's like, I don't understand you. Can you please repeat? And it's like, oh yeah, please, just operator. But that's been me sometimes. It's like, please let me talk to a human. But I think there's a lot of different things that people can do. But I think the first thing is also just being aware of people in your community who is suffering. Because I think a lot of times suffering can sometimes be hidden, and
Mm-hmm.
in
Mm-hmm.
many ways people are indeed suffering. And there is limits about like how much you should be willing to ask, especially like if you maybe do not know someone as personally. But like I would say, your coworkers, even your neighbors, like some of them may not want to talk about it, but a lot of them may be like, yeah, this is something that's really important to me because it's impacting my life in a big way, and therefore, if you're willing to try to, help me, even if it's like maybe like, oh, I have my treatments on this day, I can't make dinner in the evenings. Maybe it's just something as simple as that. It doesn't need to be, trying to help people through this really hard insurance policy. I guess it's like what the person needs as well as what you are able to give as well.
Yeah, yeah. So, is any of that happening in Rochester that you're aware of? Are there things or these groups or activities or things like that raising awareness, helping people with insurance, navigating the system? Is that happening?
I would say yes, but not to the extent that it needs to be happening. So for example, sometimes it's like a lot of sources that I know about are like they typically deal with like refugees. So they have those services to help the refugees understand, which is very important, don't get me wrong, but like also like people who maybe have lived in Rochester their whole lives also need to be aware of how these services work. But since these
Mhm,
organizations are specifically catering to refugees, they feel like, hey, I'm not welcome to get my advice from here. There are also some like legal advice clinics as well, some of which are freer than others. Some have a little cost associated with them. And I would say
mhm,
there is also like support groups as well for people who are have physical illnesses as well. Like I was looking at the hospital page, and it's like, oh, this group is for like young adults living with this, older adults living with this, people just in general with this. So these some of these groups do exist, but like I think there's also a sense where it's like, oh, it's like, oh, people with this and their caregivers. Well, I'm not a caregiver, so they're not going to want to hear from me, kind of thing. But
mhm.
perhaps some of them they would like to hear, some support from the community as well. And I think the hospitals could probably do a better job also getting like awareness out about these groups besides, on like their dedicated like, oh, today is National Pancreatic Cancer Day. Let's, highlight our group, but like highlighting these groups more regularly as well. But
Mhm.
I will also admit, like, I may not be the target audience for their advertising as well. So maybe that's why I just like never ever see it, or maybe I never ever see it because there really isn't any. So it's I'll be honest, it's hard to tell because of my demographic as well. So
Yeah, no, that makes sense. I mean, obviously, you wouldn't be as dialed in, but you are a member of the public, and so the idea of seeing and being aware of these things would be what the goal would be for a lot of these organizations to at least share the information, just in case you're interested in engaging the service, you know where to go or who to talk to, and so that would be important. So, in a lot of places, the way that the communities kind of function and operate and what they experience often drives what's available to them, right? So, if you have a certain industry, you have supporting, you know, facilities and services that support the industry and blah, blah, blah. Think about it on the reverse. If we know that Kodak was here, that these health issues are correlated to exposure to chemicals from Kodak, do we have, or not we, does Rochester have like the kind of healthcare system, health centers? I think there's a medical school there, doctors, specialists who understand the impacts, the health impacts of these exposures, and are they able to provide the kind of services and the kind of support to people who have those illnesses because we know that's more prevalent because of the exposure? Like, is that available as well? Is that part of the system in Rochester?
Hmm. So I think there's like two different questions in there. So like one is like, do we have like the facilities to like treat a variety of different conditions? And I would say yes. There's a ton of different centers. Is there a center for everything? Probably not. But I feel like there's also like people constantly funding. We got like the cancer center. We have like the center for like people with pregnancy. We have like different we have like an eye institute. We have like a skin institute. We have a bunch of different things because we do actually have two different large medical employers. So the University of Rochester Medical System and then the Rochester Regional Health Center that both kind of operate out of the Rochester metropolitan area. And a lot of people
Mhm.
often from like the outlying more like rural areas will often like come in for those specialty treatments because they're present in Rochester, which I think is great that we even have the specialized people and the equipment and the centers to be offering this. But the problem is also there's a lack of connection between I would say we say the environmental health essentially, all the pollutants, all the chemicals in the air, the history, the legacy pollution, and then actually like the medical diagnoses. So I actually thought it was really interesting. So I was at a breakfast, kind of like a lunch and learn, but more like a breakfast and learn, if you will. And one of the guys from the Environmental Protection Agency was talking about how there was a major environmental incident, lots of chemicals were spilled. There was concern about the water being contaminated. Farmers were all like, "Can my cows drink the water? Do we need to evacuate all my cows to a different pasture because is my pasture contaminated with all the airborne contaminants?" And so the EPA went, "Well, if people are so concerned about their health, their animals' health, they should go talk to their doctor." So people went, "Okay, I don't know what to do. Let me go talk to my doctor." And then the problem is the doctor went, "I don't know," because they had never really had enough training in this. Because unfortunately, unless you're environmental health and safety specialist, which is its own unique degree while you're studying in university, you're not really trained that much on environmental health. Besides maybe that secondhand smoke can cause lung issues in children. Beyond that, that's pretty much all the I feel like all the environmental health awareness that people get, which is really unfortunate because a lot of people, when they have times of crisis, if they trust their doctor, they're gonna see the doctor as someone who they trust, someone who I trust them. They should know what they're talking about if they do give me an answer. And then when it actually happens, people are very maybe not disappointed, but more let down in the sense that oh, this person who I trust, who usually knows what's going on, doesn't know either. And I think also you can see that in medical school curriculums as well. We're so focused on teaching people how to, properly, treat patients, talk to patients, how to use the system, how to maybe do the surgery, do the procedures, that sometimes we neglect to realize the cause of this could very well be, something in the environment. And sometimes there just isn't a lot of collaborations between disciplines. Like you might go to the allergist. Allergist might be like, "Oh, well you have a grass allergy, for example," and then that can help you to realize something about yourself. But then that guy has think, "Oh, there tends to be a lot of arsenic in the air or something that could also be causing a health issue." But so there's this lack of connection besides like the regular, like I would say like this seasonal like environments, and then the actual like what coming from the factories as well. And it's unfortunate because I think a lot of cancers do have environmental risks, like we've seen with Kodak, where like the methylene chloride, even like things like the dioxin are causing these like visible, really bad physical elements in people. But
Hmm.
it's more like the sense of, oh, you're just one of the very unlucky few who got it, or maybe you just don't live in a good neighborhood. It's a lot of like particulate matter, and it would just extend to that. It's like bad air quality in general, not realizing what exactly is in that air quality that could be like maybe contributing to or inflaming your symptoms as well.
Interesting. That is interesting. And that's something to think about too. I mean, we do need doctors and healthcare professionals who understand these connections. And particularly if you live in a place where this kind of pollution, these kinds of issues are more prevalent, you would want to be able to go to your doctor and say, "Hey, I live by the plant downtown, or I work at this facility, and I noticed me and my coworkers have the same types of issues. What should we do? How should we think about getting support and help versus just kind of being lumped in with everyone else and not having a very specific targeted plan for helping with my healthcare issue that was precipitated by this environmental situation that I'm in versus just it being hereditary, genetic, or just having, you know, un- just being unfortunate in that regard. And so I completely agree with that. And so, with all that being said, and with all that we know now, what do you think we should do? Like, I'm listening. I heard what you said. I understand now the situation in Rochester. I'm looking around in my neighborhood and my community. Maybe there's something going on there, or maybe not, but I'm concerned about what you're saying. What can I do as a listener to help or to be a part of the solution?
Hmm. So I think, like I mentioned earlier, the first thing to do is to be a part of the solution. You first must understand the problem. Otherwise, you are not going to be have the right solution to the actual problem. You may not even have a solution to even the relevant problem. So obviously
Mhm.
education first comes first, which is can be kind of challenging. But if you think about like one, we have the internet. There's a lot of great things on there. Or even just like since you live in your community, you know people who know people who know things oftentimes. So
Mhm.
start networking as well, and it can be very you know powerful when people get together as well. Um, and then another thing that you could do, I know I mentioned earlier, GoFundMe's. It does not fix the systemic issue of really overpriced healthcare, hard to reach healthcare. But I think it would be remiss to recognize that while we're trying to, fix the overall system, perhaps, that we're leaving all these people behind in the meantime.
Mhm.
I the GoFundMe is a band-aid, but we don't want also, people to be, in a sense, be bleeding out while we're trying to like fix the whole person. We also want to like maybe focus themselves on something. Because also, this system is not going to like fix itself in a year, most likely, and people are going to need help and care in the meantime. So I would say like maybe you know somebody who is on a GoFundMe, or maybe you can help somebody who needs it instead of a GoFundMe, or at least inform them about other mutual aid support options that they could engage in. Um, for making national healthcare better, unless you're like a healthcare like official, executive, a policymaker, a member of the government, I mean, you can write as many posts as you want. You can, pressure people in a sense that it has to change, but it's hard because chances are you're probably not the one actually writing the policy. So I'm like, so if we're trying to think about like how else could you, raise awareness about like what you want to see. Um, I know some organizations are very, very big on like we need to call your member of Congress, we need to write your letter of Congress. We might try to show up at their office too, like on a lobby day or something.
Mhm.
And I think that could definitely be helpful, but I think there's also cases where it's like their mind is made up because of X, Y, and Z, or they just don't want to hear you. They'll be nice and talk to you, but it's like they have, the party line to keep in tow with. Um, I'm also perhaps maybe a little uh, negative, not optimistic about like always talking like individually to a member of Congress, but like there
Hmm.
is such a thing as political will out there. But I would also say we don't need to just throw off the entire system either. I remember hearing that like people in like other countries who have national health care, they also find things to complain about their system as well. So it's not like national health care is going to solve everything. It will lead to different challenges as well. So not just being like, oh, we should do this one thing, get national health care, and then all of our issues will be fixed. No, we got to recognize it's a caveat too. There are pros and cons to both systems. And if we
Hmm.
only recognize the pros in one system, we're going to be in a very, very hard place when we have to actually be cognizant of the cons. Um, I think also it could be a matter of, unfortunately, many times in the US, we don't get to choose what health insurance plan we're on. So maybe there is a way that we can maybe have more elections in different plans for people, different cost structures, even this things like I'm not sure why some even for some procedures cost so much. It seems very very expensive. So maybe we need to have more transparent billing as well. Because a lot of times
Hmm.
when it comes to billing, you see it. Okay, I have A2 equals this. Now I gotta go figure out what the heck A2 is. Were they even properly billed? Because sometimes you are not properly billed, and it's up to you to figure that one out.
Hmm.
So having more transparent billing as well and being more upfront about the cost, I would argue as well. Because like for example, like my father went to like an outpatient facility, but the problem is it was still affiliated with the hospital, so he got charged both for the practice and then the hospital fee. So he got double charged, and he was very very unhappy because you're
Hmm.
paying for one service twice. Um, and sometimes it's very hard to even find out that hey they actually do this until you actually start like calling people, looking at reviews, and then that just takes time. um, we're very short on time in our lives, especially like if you're not doing well, and you may not have time to be doing this. So I think that's also another, transparent billing can also be a big key. There's just so much I think that could be be fixed, but I also recognize that like there are people out there who I'm sure like I know we talked about like what we mentioned personally like the 10-point plan. I don't have a 10-point plan on how to fix this. Probably somebody does, but there also needs to
Hmm.
be a will to do that 10-point plan, both on the side of one, the insurers, the doctors, the public, the government, and trying to engage all those stakeholders and get them to be enthusiastic about the same things can be very, very difficult, especially when they have different agendas and they're making they're making money. Um,
Yeah.
I'm sure
Yeah.
you probably have things as well that you would like to see changed. Do you have
I
anything in
do.
particular?
I mean, I'm not a fan of our current system whatsoever. I mean, I think if there was a way to, at the very least, reduce the profit motive, I think we would be able to focus more on the healthcare aspects versus the trying to make money aspects of it. Um, like you, I'm not an expert either in healthcare policy, healthcare analysis. Um, Obviously, people have different views of what would be a good structure for a healthcare system. The national versus the private, some combination of the two. Obviously, the biggest change we've had in recent years is Obamacare coming in and kind of reshaping what is available. Because I do think people like options, like the opportunity to choose what they believe is the best approach. So, I mean, most of us get our insurance from our employers. And so, whatever that employer is, whatever their plan is kind of what you're going to get from them. If you have an option of choosing a cheaper plan or a plan that would best fit your situation, people love choices. And so, I mean, that might be another thing to think about. I think what you said earlier is really important, though. The idea that as you advocate and talk about what you believe is best, even if you think certain things are band-aids, things like GoFundMe's, things like local community actions, don't forsake those trying to go after the big, national global shift. and leaving your fellow people bleeding out, like you said earlier. I think it's great to think, okay, community first, we're here, let's support each other the best way we know how, and then we'll continue to push people towards what we think is better, but we're not going to abandon or neglect the people who are currently suffering right now. As we do that, we're going to do both. And if we have to choose, we're going to help the people that are right around us get better, because that's the whole point of the system in the first place, is to improve the lives of other people. And so I think that should be front and center. I know a lot of people, a lot of activists who would tell me, hey, we're not even thinking about the government. They're not going to help us. They're not coming to help us. We look out for each other. I don't take that approach, but I understand it. And so I think some combination of the two would be the best way forward. I don't know. Hopefully we'll figure out something. And in the meantime, you graduate, get yourself a good job with good healthcare benefits so you and your family can be supported and taken care of as well. That's the system that we currently have. And so make sure you do that, Savannah. And anybody else listening. Oh, man, this was good. This was a very good conversation. We're up on our time. But as always, is there anything else, Savannah, that you want us to know or think about or consider as we close out this episode?
I think I would just, rehash the earlier points that we both touched on, like care for the community, advocate, educate yourself, and maybe you can be a part of that bigger change, both in one, like that, the national level, even the state level or your local level. I think oftentimes we downplay about how much impact we can possibly have.
Mm-hmm.
And if you even just talk to people in your regular life, I'm sure they would, love to tell you that how much you mean to them, how much you've done for them that has really, touched them and their lives. And I think if we continue to do that, especially in the realm of healthcare, maybe things will not improve, but every person's life matters, and it's important to keep that in mind and scope as we attempt to, make the healthcare system more equitable and accessible and affordable, and overall a better system, if you will. So I hope I can encourage people to look out for your coworkers, your friends, your colleagues, the person at the bus stop who you've never met before, because we're all in this. We're all in, you're all in your community together, and I guess that's what I would end on, perhaps.
No, that's great. That is fantastic. I completely agree that we're all in this together. We all want the same things. We want health. We want safety, security. We want to live lives that allow us to be our full selves. And so I completely agree. And we're going to end on that positive note, because I know that's going to encourage a lot of people to go out and do some amazing things. So with that being said, I want to thank Savannah, and I want to thank all of you for listening to this episode. Savannah, thank you so much for being with us. She's going to be here for the next one too, so stay tuned for that. So Savannah, thank you so much for being here.
Of course, thank you for having me.
Yes, and thank you for listening to the Environmental Justice Lab, where we are for the people and for the planet. We'll see you next time.